Greetings, everybody. I'm Dr. Al-Bustami, one of the IM residents here at UTRGV at DHR, and I'm thrilled to present our case report here, Reactivation of Latent Tuberculosis in a Patient with Recent COVID Infection by me, Sahar Panchwani, Adriana Saavedra, Dr. Soler, Dr. Sainz, and Dr. Varghese. Mycobacterium tuberculosis is a well-known pathogenic bacterium that causes tuberculosis, a leading infectious cause of death in adults worldwide. With the advent of SARS-CoV-19, Mycobacterium tuberculosis' incidence in patients with exposure to the virus remains to be investigated. There have been several case reports regarding mycobacterial co-infection in patients with COVID. However, little is known regarding the interaction between the two microbes and their combined effects on the body. In this case report, we hope to elicit more on the relationship between the two microbes and their pathogenic effects. Case description. We had a 31-year-old female with a past medical history of COVID infection in June 2020 who presented to the ED with a chief complaint of cough and fever. She reported having a 3-month history of persistent right lower lobe infiltrate and lung abscess on chest X-ray and CT chest since she had the COVID infection, with no improvement after multiple courses of antibiotics. She only received supportive treatment for COVID infection. On admission, she reported having productive cough with thick yellow sputum and right posterior pleuritic chest pain, which was relieved with naproxen and ibuprofen. She was also noted to have a 1-day history of fever, chills, night sweats, and nausea. Her saturation was appropriate on room air, and physical exam demonstrated decreased breath sounds and rales during auscultation of the right lower lung. Labs were remarkable for leukocytosis, and she was started on broad-spectrum antibiotics and admitted to the floor for further workup. Chest X-ray and CT chest revealed persistence of the right lower lobe infiltrate and was also significant for cavitations and tree and bud distribution consistent with the patient's history. Here we have an axial cross-section of the CT chest demonstrating the multilobar infiltrate. Samples were collected for fungal serologies in culture, sputum gram stain in culture, acid-fast bacilli sputum culture, and tuberculosis PCR. She was diagnosed with active pulmonary tuberculosis after her sputum, AFB, and TB PCR were positive. She was started on antituberculous treatment with RIPE. She was discharged after subjectively feeling better 4 days on RIPE therapy and was discharged in accordance with the County Department of Health guidelines. Here we have a sagittal cross-section demonstrating impressive cavitations in the right lower lobe. The patient endorsed exposure to TB through her work as a nurse and states that she had prolonged contact with tuberculosis-positive patients in 2013 and 2017 and had a recent exposure in April 2020. She had a positive PPD of 25 mm in 2017 with a negative chest X-ray and declined prophylactic treatment. The data is limited on COVID-19's impact on latent TB infection. A positive COVID-19 result does not eliminate co-infection with TB. Persistence of respiratory systems after COVID-19 infection warrants additional testing for TB. There are conflicting studies as to whether tuberculosis is a risk factor for COVID-19. However, those with tuberculosis co-infection have been linked with disease severity. It may be important to suspect tuberculosis reactivation in patients who do not recover following COVID-19 infection, who had previous exposure to tuberculosis. Persistence of respiratory symptoms and fever may warrant additional testing with AFB culture and TB PCR. COVID-19 may predispose to reactivation of latent tuberculosis, but further research is required.